This video will cover asthma medication ratio pharmacy measure. The population that falls within this category of pharmacy measure are patients between 5 to 64 years of age who were identified as having persistent asthma and had a ratio of controller medications to total asthma medications of 0.5 or greater during the measurement year. The numerator for this measure is the number of members who have a medication ratio of 0.5 or greater during the measurement year. The way to go about in calculating and finding this ratio out is by following a few steps. Step 1 is for each member, count the units of asthma controller medications dispensed during the measurement year. Step 2, for each member, count the units of asthma reliever medications dispensed during the measurement year. Step 3, for each member, sum the units calculated in Step 1 and Step 2 to determine units of total asthma medications. In Step 4, for each member, calculate the ratio of controller medication to total asthma medication using the following formula. Before you do that, you want to make sure you round to the nearest whole number using the 0.5 rule. So you take units of controller medication, which you got from Step 1, and you divide it by units of total asthma medications that you found in Step 3. Finally, in Step 5, you sum the total number of members who have a ratio of 0.5 or greater in Step 4. Exclusion criteria for this pharmacy measure is as followed. The required exclusion criteria is emphysema, COPD, obstructive chronic bronchitis, chronic respiratory conditions due to fumes or vapors, cystic fibrosis, acute respiratory failure. And lastly, members who had no asthma controller or reliever medications dispensed during the measurement year. This pharmacy measure utilizes pharmacy claims to determine how often controller medications versus rescue medications were filled. In this chart over here, you see a list of asthma controller medications that you can use as a reference when referring to these pharmacy claims. Please keep in mind that medications that are considered rescue medications are albuterol and levoalbuterol. Some of the best practices that we recommend at Arizona Care Network to address this pharmacy measure is to utilize the childhood and adult asthma control test on a regular basis to assess and reevaluate asthma control. Second, work with patients to develop a collaborative asthma action plan and educate patients on the reduction of asthma triggers. And lastly, our care coordination team can provide patients with individualized support. To refer one of your patients, please contact us at 602-406-7226 or 1-855-218-3451, or you can email us at the following email. You can always increase your performance by collaborating and working with your CPC to educate your team. Make sure to build workflows to chart prep and identify open gaps before a patient comes in for an appointment. And always know your Arizona Care Network resources available to you. First and foremost, your CPC and the education and support they provide for you, quality measure tip sheets that are available on our website, and Arizona Care Network provider portal, and of course, our Arizona Care Network care coordination team. Please visit the Arizona Care Network website for updated 2024 tip sheets. The picture that you see on the slide is a snapshot of our asthma medication ratio tip sheet, which you can find on the Arizona Care Network website.